Pleasant good evening to all our viewers. Welcome to Straight Talk. And for those who do not know what Straight Talk is about or has ever heard of Straight Talk is a program that facilitates conversations about relevant issues in the areas of marriage and the family, health, and finances. Tonight, viewers, we have a very special guest on the platform with us to speak about menopause and hormonal changes in women. And he will also be talking about things that we need to know as men so we can maintain that marital bond. Before I go my wife will do further introductions, but let us pause and have a word of prayer at this time, shall we? Father in heaven, hallowed be to your great, your holy and matchless name. Tonight, we are very happy that you have been with us throughout today, that you have protected everyone on this platform, given us all a safe day, and you have brought us here in this little space where we will have a conversation about an area that is challenging to most people. I pray that you will be with us, be with the presenter, and may this be a wonderful, engaging conversation, and may at the end, everyone would have left learning more, and that families will be better able to relate to each other. We give you all the honor, we give you all the praise, we give you all the glory. In your son's matchless name we pray. Amen. Just to let you know that questions will be facilitated via the chat. You can send your questions via the chat to the host, and at the appropriate time we will pass on the questions. It promises to be a wonderful evening. I hope that you will just get the popcorn rolling, some ice cream, and let us have a wonderful time. Turning over to you, Avani.
It is my privilege to introduce our guest presenter for tonight. Our presenter is a graduate of the University of the West Indies. He graduated from the medical school in 1989. He completed specialization in obstetrics and gynecology in 1997 and started his private practice that same year. He is the founder of Hope, which is helping others progress emotionally. It's a support group for women with miscarriages, stillbirths, and newborn deaths. He's also the founder of Protect Our Children, children's rights advocacy group. He's a volunteer and a board member of Jamaica Cancer Society. He's a poet, a comedian, a songwriter, social commentator, Gleaner columnist, and human rights advocate. He is married with 3 children. His hobbies include music and origami. Other interests includes religion and human sexuality. Ladies and gentlemen, I present to you Dr. Michael Abraham.
Thank you very, very much. I really appreciate you having me. And I've been looking forward to this because I know there are a lot of questions about women and hormonal changes that are very complicated. Many of these changes, even women themselves don't understand, much less men. And I don't really want to give a long talk or lecture, so I'll just briefly speak about hormonal changes in women. I want to talk about hormonal changes during the menstrual cycle, during pregnancy, and during the menopause. And what I want to do is to explain it in a way, to present this in a way that would explain some of the changes women go through, so that especially their partners, their husbands, their spouses can understand. Um, I don't have a very long attention span myself, so I don't want to talk too long. So I'm going to start off by talking about the menstrual cycle. And most of us have an idea that women have a menstrual cycle. It's really a cycle. It's usually called a monthly cycle. Most women will say a period once a month. And these are women in the reproductive age range. So you're talking about from teenagers until a woman is about early 50s for the average woman. The average woman reaches menopause at 51 or 52. That's the average age of menopause. And that has remained constant for a long time. The average age of menarche, or when women start to actually see the period, has been getting lower and lower and lower. So it's not uncommon for me to meet women who started seeing their period at about age 8 or 9. So with the menstrual cycle, there are a lot of hormonal fluctuations. There are two main female hormones, estrogen and progesterone. For those of you who I can see your faces, you can nod if you understand what I'm saying. I only seen 2 people, 4 people, but you know what a menstrual cycle is. Good, thank you very much. Thanks. I see a thumb. Great. All right. So these hormones go up and down, you know, and it's important to understand that with the menstrual cycle, they don't only undergo physical changes, but they undergo psychological changes or mental changes as well. So you find as the time for the period approaches, women develop certain symptoms, and the symptoms vary from woman to woman. Every woman is different. Not all women will experience this. Some women don't even realize when the period is coming. They don't have many symptoms before, and when the period is actually there, they have just a little discomfort, and that's it. Some women will know when the period is coming, apart from looking on the calendar, because they'll have certain changes. For example, some women may experience bloating. Some women may experience breast tenderness. Some may experience mood swings or pelvic pain. And I gather a lot of this is about, as I said, in the context of relationships. So it's important for men to understand, if you have a partner who is in the reproductive age range, seeing a regular cycle, that women will change based on the cycle in terms of their moods, and especially their approach to sex. It's very important to understand this because men have no cycle. We have no menstrual cycle. So men think about sex a lot, and men are nearly always ready to have sex. Women are different, and it's important for men to understand that these moods change significantly and can change significantly with the cycle. So for example, if a woman has a regular cycle, let's say every 28 days, she ovulates in the middle of that cycle, about day 14. And you find that some women, their sex drive may actually increase around the time of ovulation, which can be a tricky thing if she doesn't want to get pregnant, because if he's not using some kind of contraceptive method, or if the man is not using a condom, that's when pregnancy is likely to occur. But it's a known phenomenon that many women, the drive will go up at the time of ovulation. Not only that, it has been found that at the time of ovulation, women, the type of partner they want to have sex with can actually change as well. I don't really want to get into any mix-up, but that's a fact. You find that some women have the desire to have sex when the period is about to start, or even during the menstrual flow itself. Some women totally get turned off at that time, on the other hand. So it's important to understand there are times when women will have these changes when for physical, or remember, some women can have mood swings. So for physical reasons, for example, if a woman has significant bloating before the period, and she has significant breast tenderness before the period, and you go to your spouse and you start to touch her up for sex, and she's having this physical discomfort, in addition to the mood swings, it may not work out too well. And it's important for everybody to understand. As I said, even some women don't understand. I remember when I was working at Spanish Town Hospital, one of my friends who worked in the lab told me that she honestly thought she was going crazy before her period. She actually thought she was literally going crazy because she'd have these periods where her moods will change radically. And it was when she went to get it sorted out, she realized that it was a cyclical phenomenon and it used to occur before the period. And what she had was PMS. I call it premenstrual syndrome. And it's a situation where women get severe discomfort before the period. So the cramping is severe, the breast tenderness is severe, the mood swings are severe, they can get cramps, they can get headaches. And sometimes the mood swings are so radical that it's classified as a disorder. I don't want to get into too many technical terms, but one of the terms is late luteal phase dysphoric disorder. I really want to get into the long word stuff, but some women will actually require medication to help manage the symptoms before. If you're a woman and you're watching, some of the ways in which you can manage this is, for example, to alter your diet. The good thing, Philip, you told me that you're an Adventist. The good thing about Adventists is that Adventists pay a lot of attention to what they put into their body, and that's extremely important because you find that if you have a healthy diet, for example, you're not drinking alcohol, you're not drinking too much refined food, you're not having too much sugar, you avoid caffeine, you find that avoiding those types of food, especially before the periods, may be beneficial. Another way of dealing with it is exercise. Regular exercise helps to diffuse the symptoms as well. Another way of dealing with it is to deal with your environment, because health is not just physical, it's mental and social well-being. So if you are, for example, in a relationship that is acrimonious or toxic, it has the potential to heighten or worsen your symptoms as well. So it's important to look at that aspect. And there are some people who may benefit from, as I said before, actually being medicated, although it may not always be necessary. So it's important for women to understand themselves, understand the cycle, and to communicate with their partner. So for example, if a woman realizes that, hey, I'm starting to feel this way, it's a good thing to communicate to her partner. Listen, I'm going through these changes and I'm feeling a bit uncomfortable. Because failure to communicate has damaged many relationships. So if a man is approaching a woman and she just pushes away his hand, he may feel rejected. And you know how fragile the male ego is, right, Philip? It's very fragile, extremely. So it's important to explain and say, listen, it's not about you. I'm going through this. And it's important for men to also understand and empathize with women. We need to understand that we don't have a cycle, but women have cycles. Women are not always up to it. And it's important to understand that, you know, apart from even the cycles themselves, if you have a relationship in which you do not communicate or show respect, and there's some discomfort from the woman's perspective, it's going to affect her drive as well. So we're going from the menstrual cycle now to pregnancy. And that's another type of hormonal upheaval. And again, it varies from woman to woman. It varies a lot. Some women go through pregnancy relatively unscathed. They miss their period, they take their prenatal vitamins, they go to the doctor, they go in labor, they deliver, and everything is wonderful. For some women, it's a bit more turbulent. So with these hormonal changes in pregnancy come varying physical symptoms. So for example, most people have heard about morning sickness, which unfortunately for some women is not just confined to the mornings alone. And that is because of the hormonal changes in pregnancy. One of the good things about morning sickness is that most women who experience nausea in pregnancy will not miscarry. So women who have a lot of nausea have a lower risk of miscarriage or losing their pregnancy than women who do not. And it's thought that the nausea probably responds from an adequate hormonal response to the pregnancy. So that may actually be a good thing. On the other hand, if the nausea is so severe that it causes a lot of vomiting, medication or even hospitalization may be required. The thing about these hormonal pregnancies, the hormonal changes, is that they can cause other physical symptoms or changes. So for example, there's a hormone called progesterone, and progesterone tends to slow down the gastrointestinal tract. And in pregnancy, progesterone is elevated significantly. So you find that it's not uncommon for women to have constipation in pregnancy. It's not uncommon for women to have acid reflux or indigestion in pregnancy as well, because the gastrointestinal system or the bowel kind of slows down. This hormone also relaxes veins. So it's not uncommon for women to develop varicose veins in pregnancy or hemorrhoids as well. So you have these varying changes. And as the pregnancy goes on, with these hormonal changes, you can also get emotional or psychological changes. Some women become extremely labile, very emotionally labile in pregnancy, meaning that the moods can go up and down. Sometimes they will cry and they have no idea. I don't know if any women watching this have experienced this, but sometimes you're having a good day and all of a sudden your mood changes and you want to cry, you don't know why you want to cry. Anybody? Yeah, right, it happens. I remember when my wife was pregnant with my first son, one day we're having a conversation and I don't know, man, she just started crying and I was like, what did I say? You know, and I realized that it was part of the lability. It affects your appetite as well. Sometimes a woman may feel to eat something one day you feel like you want to have callaloo, and the next day callaloo make you vomit. It's really strange, but these are the changes women go through. And as the pregnancy progresses, you find that from woman to woman, it varies in terms of their desire for sex. Some women, because of the nausea and the physical discomfort and the hormone changes, their sex drive may decrease significantly. And again, it's very important for men to understand this. It's important because some women, it's not about the man either. Sometimes the desire just goes for varying reasons. The converse is also true, because sometimes women are pregnant and they want to have sex, and it's the partner who doesn't want to have sex. Because some men feel a bit uncomfortable having sex with a woman who's with the partner when she's pregnant. Some men have a fear that having vigorous sex can precipitate labor or miscarriage, so they can be afraid as well. And it's important for couples to have these conversations and not talk about it. Because some women really don't understand the need that a lot of us men have for sex, and they trivialize it. They figure, okay, I'm pregnant, it's all about me. And a lot of it is about you, but that's your partner's child as well. And a lot of men have to understand, women aren't always thinking about sex either. They're not always going to be in the mood for that. And it's important, especially as the pregnancy goes on and there's more and more discomfort and more nausea, it's important to understand that these changes take place. Another thing that can be disruptive is the immediate postpartum period, which is after the baby's born. Because during pregnancy, you have this flux of hormones, and then when the baby comes out, the hormones start to change again. And some of them can drop, the levels can drop precipitously. And you find that, again, after delivery, some men may be a bit down. It's a situation called postpartum blues, where some women feel a bit down after they deliver, and that is transient, like a few days after delivery. But then you have some women who develop postpartum depression, and that's a whole nother story. Because some women get extremely depressed after, because pregnancy itself is overwhelming. It's a constellation of factors. First of all, during pregnancy, your body changes in ways it has never changed before. You go on a scale and see weights you've never seen before. You stop seeing certain body parts. They deliver. You have this, your body start to change again. You have a crying baby, you have to be keeping up at night. You have to be breastfeeding. Sometimes the breastfeeding can be very frustrating. It may not work out. Sometimes you have a partner who is absent or is not very helpful. It's a lot of things, and it's really heavy for women to deal with this. And it's important, again, for men to understand. It's also important to understand the signs and the symptoms of depression. because many persons don't get treatment when they should. And if the depression is not managed, it can become severe and lead to psychosis, which is when you lose touch with reality. There are women who have actually killed their children after delivery, and it's not that they were wicked, but some of them basically go off and lose their minds, become psychotic, and do really strange things. So just briefly, many of us know what depression, what the symptoms are, but let's go through them again. Significant changes in eating habits, significant changes in, say, may eat a lot more or lose your appetite, changes in sleeping habits, like wanting to sleep too much or being unable to sleep, feeling sad or depressed, feeling this lack of energy, having difficulty concentrating, forgetting a lot of stuff, being irritable. All of those are symptoms of depression. If they go on for 2 or more weeks, you really ought to get help and tell somebody about it. So you have the menstrual cycles, then you have the pregnancy, and then we have menopause. It's inevitable that if a woman lives long enough, she'll enter menopause, and the average age of menopause is 51 to 52. Some women enter menopause very early. We call that premature menopause. So if a woman enters menopause at about 35, that's premature. And menopause occurs naturally when your period has stopped for at least 1 year. So if in your late 40s, early 50s, and your period start to get haywire and then they stop, and you have not seen a period for a year, you're officially in the menopause. And again, this varies from woman to woman. When my mother-in-law entered menopause, she was ecstatic. Maybe because, it's because she's a midwife and she understands these kind of things and she has 3 children, but she was happy. And she was happy to sit up, head back at the period, and that was the end of it for her. For some women, it's a bit more turbulent. So for example, if a woman has a history of infertility or losing pregnancies and realizes she's now in menopause and that phase of her life is over, it can be devastating to deal with. Some women have significant symptoms such as hot flashes, which is a strange phenomenon for us men to hear about, but it's like you feel a wave of heat going through your body and you start to sweat. I remember the first time I saw a woman having that, it was in the parking lot at university. I was a resident in obstetrics and gynecology, and a senior nurse was talking to me in the parking lot, and she just said to me, look at it, look, it's coming on now, it's coming on now. And then she just started to sweat profusely. That's what hot flashes are like. The thing about these changes is that they can be distressing for some women, can cause a lot of discomfort. Some women have a lot of sleep disturbance because if these are going on in the night and you're not sleeping well, it can disturb your sleep. And if your sleep is disturbed, you find that during the day you can feel tired and irritable. Some women have mood changes and they may become depressed. There are also physical changes. So for example, one of the commonest changes is that some women experience vaginal dryness. And that's because the female hormone estrogen is important to maintain, for example, the breast and the vagina. In menopause, what happens is that the ovaries stop producing estrogen. And with that, with a lot of women, they have vaginal dryness and they have difficulty with intercourse or uncomfortable intercourse. Some women complain that they may have a lower sex drive because of the hormonal changes as well. On the other hand, some women have no change in their sex drive. Some are extremely active. Some are even happier because they know that they can't get pregnant anymore. So they are less inhibited. And again, if you have these symptoms, it's good to get to be checked out and to get help, because in some cases, medication may be useful. In some cases, lifestyle changes may suffice. But basically, that's just a summary of the changes that women go through from youth into midlife and beyond. And as I said before, I don't really want to talk too long. I just gave you a summary. What I'm interested in is hearing what you all have to say, because One thing I've learned as a gynecologist is it's a humbling experience for me, because the more I learn, the more I realize how much I don't know. I'm a man. I don't have menstrual cycles. So a lot of what I learn is what I read in books. But a lot of what I have learned is from listening to women speak as well. So, Philip, we can have some kind of question and answer thing now, if that's okay with you.
Yeah, so viewers, you may post your questions in the chat. We will facilitate those questions at this time. In the meantime, we'll ask a few questions.
Okay, good night, Doc.
Hi.
Does having a hysterectomy will cause menopause?
Are you asking if?
If you have a hysterectomy, will it cause menopause?
That's a good question. So let's go into that. Oh, I wish I brought a uterus with me. I would show you. All right. Because I have one on my desk. Not a real one, a model one. But anyway, hysterectomy means taking out a woman's uterus. The ovaries are what produce the hormones, the estrogen that keeps menopause away. So if you take out a woman's uterus, she may not see a period. She will not see a period because there's no uterus to bleed. But she may not actually be in real menopause because the ovaries may still be working. So if a woman has a hysterectomy and she's 45, for example, and she's seeing regular periods and you take the uterus out, she won't be bleeding, but she will not enter real menopause because her ovaries will still be working. On the other hand, if a woman is seeing cycles and you do a hysterectomy and take her ovaries out, not only will she go into menopause, but she'll go into sudden menopause. Because when it occurs naturally, it's a gradual process. So for example, some women, years before menopause even starts, will tell you they start to feel hot flashes. But if you do it surgically and you take it out right away, then the symptoms are sudden and they can be more severe.
Okay. If you're on contraceptive that causes you not to see your period, how can you know you are menopausal?
That's a good question. So if you're on contraceptives that prevent you from seeing the period, the way to know if you're menopausal or not is to come off the contraceptives and have certain hormone levels checked. So for example, if you're on the pill, it will be good to come off for at least a month and get your hormone levels checked. And that will tell you, because if you do the test when you're on the pill, you won't get a true result.
Okay, the next question.
As a matter of fact, hold on, going back to that other question you asked about the hysterectomy. Mm-hmm. Just this week, a patient of mine came to my office and she had a hysterectomy in her 40s. And she came to the office because she thought she may now be really entering menopause because she started to have hot flashes. So I sent her to have the hormone test done because she can't rely on whether she's seeing a period or not because she hasn't seen one since the hysterectomy. So the hormone test is to see if her ovaries have stopped functioning now. So that's why you would know.
John, how can I prevent hot flashes?
That's another good question. It's really hard to tell you how to prevent it because the incidence and severity vary from woman to woman. Some women will enter menopause and have no hot flashes whatsoever. Some may have severe hot flashes. So it's hard to really tell you how to prevent it. Once it has been established, the most effective way to manage it is to use hormone replacement. And that's the most effective, not the only way, because there are natural methods people will use. So some people will use dietary manipulation. There are certain herbs people will use like black cohosh and dongquan, that kind of stuff, and it may help some people. But the most reliable way is to use hormone replacement. And it's not for the rest of your life either. It's not something you have to go on and stay on for the rest of your life. but for like about, let's say at least 6 months or so, a trial of it may help to improve your quality of life. And the type of hormone replacement you go on when you reach menopause depends on whether your uterus is there or not. Say if you have no uterus, you've had a hysterectomy, what we will normally do is give you estrogen or some type of estrogen, and that normally helps. If you have a uterus in, we give you a combination of estrogen and another hormone called progesterone. I don't want to get too complicated, but there are ways of managing hot flashes and menopausal symptoms.
How does menopause cause bone losses?
One of the bone, all right, when you say bone loss, it definitely can. And that is one of the reasons, for example, why some women may benefit from hormone replacement, because when the estrogen level falls, the bones have a tendency to become a bit more brittle. And that's why elderly women are more likely to get certain types of fractures, such as hip fractures or wrist fractures. They're not uncommon in elderly women. And that's one of the issues with menopause. And hormone replacement can put off that risk. Regular exercise helps to decrease the risk of the sequelae of bone loss as well. So it's important that when women are menopausal, that they exercise regularly as well. I've been honest, it's only you one asking questions though.
All right, so good evening, Doc. This caller is asking, is there any available medication for women whose hot flashes and night sweats are affecting their sleep?
Most definitely. Most definitely. And as I said before, the hormone replacement treatments work very well. The research has shown that, and I found that from my own experience managing women who have severe hot flashes, that the hormone treatment really does work. The thing is that when you use the word hormone, some people are terrified when they hear that word. They think, oh my God, I don't want to ban any hormones, but you have a wide range of hormones, okay? And in medicine, what we look at when we're treating a patient is, do the benefits outweigh the risks? Those are the questions you ask. So for example, if a woman has a lump in her breast and she's undiagnosed and doesn't know what it is, you really wouldn't want to put her on hormone replacement until she gets that sorted out, because you don't want to accelerate anything. Hormone replacement does help, because with the decrease in the hot flashes, you get better sleep quality, you get less fatigue in the day, you get less vaginal dryness and less sexual dysfunction. So it does help.
Can tell us, Doc, can menopause affect the memory, and if yes, also?
If menopause can?
Affect the memory, your memory.
Yeah, it can affect memory, but the thing is that getting older, whether you're male or female, does affect memory as well. So it's a combination really. Menopause by itself is not really a strong factor with that. It can be very distressing for a lot of women and stressful for a lot of women, and that in and of itself can affect memory. But it's really more the aging process in men and women.
This caller says, I'm having intense headaches and chronic pains during period, dizziness, and this was never the case. Am I pre-menopausal? And also, am I having heavy sweating during sleep at night? Well, she says she's having heavy sweating during sleep at night, yes.
That doesn't mean she's premenopausal at all. You find in a woman's lifetime, sometimes the cycles can change, even without being menopausal. This person mentioned pain. So it's important to have that checked out, because there are certain conditions that can cause pain. I see a question here about someone asking about endometriosis. I see that question here. So I don't know if you've heard about endometriosis, but that's a notorious cause of period pain. And when women see their periods, what happens is that the lining of the uterus is shed. So during the cycle, the lining is built up in anticipation of a pregnancy. If no pregnancy occurs, a woman sees her period. So the lining is shed along with blood and it starts over. So women will shed through the cervix and it goes out through the vagina and they expel it. For some women, some of this goes backways up into where the tubes are and it spills internally. And what happens is that some of the lining ends up in the pelvis, for example, on the surface of the uterus, on the ovaries, on the bowel, on the bladder, and that can cause severe pain. And that's known as endometriosis. It's a very common cause of severe period pain. Fibroids can cause period pain as well. So that person will ask the question, if the periods have become very painful, what they need is an examination, a consultation to find out if there's anything in our pelvis causing the pain, such as fibroids or endometriosis. Some women have a lot of headaches associated with the period as well. And it may be along with the PMS symptoms from before, and that should be evaluated as well. It's such a thing as menstrual migraine, so that should be evaluated.
All right. Can hot flashes change your skin color, especially your face? I feel a scoring heat in my face, this caller says. Face color changes completely.
If you're light skinned, your face can become flushed. So that can happen because what you have is the blood vessels in the skin dilating or opening up with an increased blood flow, and that can definitely, it can make your face look very flushed. So that can happen.
Interesting question here. During pregnancy, is there any sleeping position that is not recommended?
During pregnancy, if it's early pregnancy, where it doesn't really matter, but as the pregnancy progresses, we encourage women to lie on their side, preferably the left side. The reason why it's better to lie on your side is because as the uterus gets bigger and it carries the baby, there are these vessels to and from the heart called the aorta and the vena cava. So when you lie flat on your back with a big uterus, it can actually obstruct blood flow to and from the uterus and the heart, and it can make you feel dizzy, make you feel like you want to pass out. And it can also obstruct blood flow to the uterus and the placenta and the baby, which is what you really don't want. So if it's early pregnancy, like the first 3 months, it really doesn't matter that much. But as you go into pregnancy beyond like 5 months, 6 months, 7 and beyond, it's really best to lie on your side.
How do you go about getting a hormone test? Somebody wants to know that. This could be a business opportunity.
Just visit a doctor and just explain what is going on, and they'll request the relevant ones. Every now and then people say they want a hormone check, but there are so many different types of hormones. So for example, there are these hormones from this gland in your brain called the pituitary gland that can control your thyroid gland and control your ovaries. Then there are hormones that are secreted by the thyroid gland itself. Then there are these hormones that are secreted by the ovaries themselves. So it's really best to see a physician and describe the symptoms you have for them to determine which hormone test would be appropriate.
All right. Is it a fact that the bones, when the bones get brittle after an hysterectomy, is it a fact that they do get brittle? And also, if it is a fact, how can this be helped?
All right. Having a hysterectomy per se doesn't make the bones brittle. Going into menopause or have your ovaries taken out where the estrogen level drops, where your body has a very low estrogen level, that puts a woman at a risk of having what you call brittle bones. But again, it depends. It varies from woman to woman, and there are different factors. For example, it's been found that white women, for example, Caucasians have a much higher risk of that happening than Black women. It's not as common among Black women as it is among white women. You ask what can be done about that. There are varying treatment modalities that are used to manage that. So again, there are medications that can help to stop the loss of bone during the menopause. There are medications taken specifically for that. Some are taken daily, some are taken once a month, but it can be helped and managed.
Thank you. I'm going to ask 2 questions in one here. One, can menopause cause hair loss? And also, can you conceive while going through menopause?
Some women do experience hair loss, and it is possible to conceive around that time. It's very unlikely, it's extremely unlikely, but it can happen. It definitely can happen, especially if you get help, medical help. Because I mean, nowadays women in their 60s have gotten pregnant with the help of medical technology. So it's possible, but it's unlikely. The older woman, when a woman starts to reach her late 40s, it becomes less likely. But I delivered a patient who was 46 last year. So it's always important to make sure a woman is actually in menopause before she stops any kind of contraceptive method that she may be using.
Thank you. Caller wants to know, is it possible to have hot flashes and still see your period?
Yes, it is. It is. During the years approaching the menopause, we call it climacteric. There's a period where women can actually have hot flashes and they're still seeing their period. So having hot flashes does not mean that you're actually menopausal already, but some women start to experience it even a few years before the menopause starts. So that can happen. That can definitely happen, and it does happen to some women.
Well, this question seems like it's coming from a male. What are some of the do's and the don'ts for men when our wives is having hot flashes?
I like that. Those to just be as supportive as possible. You know, offer the fan or turn on the AC or be as supportive as you can. That's the best advice I'd give a man. And to be empathetic and try to understand that it's uncomfortable for her.
Thank you, thank you. How serious is it, doc, for one to have ovacysts or fibroids?
That's a whole other thing now. So I'm going to go into all that for you now. Start off with fibroids. Fibroids are growths in the uterus. They are non-cancerous growths. And they are very common, especially in Black women. So we see them a lot in our population. The thing about fibroids is that when a woman says she has fibroids, merely saying you have fibroids doesn't really mean anything. It's like saying you have a mole on your face, for example. From when I was a child, I remember seeing Marcia Griffiths with a mole on her face, and she always had a mole on her face. It didn't trouble her. You understand? What is important with fibroids is the location of the fibroids and the size and the symptoms. So there are many women walking around with fibroids who don't even know they have fibroids. There are many who know they have it, but it's not causing a problem, so you leave them alone. If, however, the fibroids start to get really big, that can be a problem. If the fibroids start to cause problems with the period, like when the period's longer or heavier or more painful, that can be a problem. 1 minute. If the fibroids cause fertility problems, that can be a problem. So it depends on the size of the fibroids and where they are. The fibroids develop in the walls of the uterus. Some fibroids, I wish I had some to show you. I'm trying to find something on a mango to show you.
All right, now.
I'm going to try to demonstrate something to you. Hold on. Soon come back. Let me show you something.
Okay, ladies and gentlemen, I hope that you are learning and your questions are being answered. We are on Straight Talk, which is a program that provides and facilitates conversation about marriage and family issues, finance, and health. If you have areas of interest within the areas I mentioned just now, please feel free to share with us, and we will get appropriate facilitators to engage us in a conversation so that we can all learn and become more knowledgeable and aware. Welcome back, Doc.
We're trying to say something with this mango.
All right.
So if this is the uterus, right? This part here where the seed is inside the uterus where the baby develops, right? Fibroids always develop in the wall of the uterus, like here or here or here. Some women have fibroids that start here and they end up bulging on the outside. Those usually don't cause many problems. If the fibroid stays within the wall of the uterus here, it may cause problems. But when the fibroids start to push into this part here where the baby will develop, where the period comes from, those are the worst ones to have. Because when they start to bulge into that area, they can significantly affect a woman's period and they can affect her fertility as well. So if a woman has fibroids and they start to give problems like that, then it may be appropriate to remove them. But every woman who has fibroids does not need to have surgery. In terms of the cysting now, a cyst is really a collection of fluid. Imagine a balloon that you fill with water. That's basically what a cyst is like. And cysts can appear and they can occur in many different parts of the body. Cysts can occur not only in ovaries, but you can have cysts on your eyelid, under your tongue, your kidney, all over the place. So again, if a woman says to you, I have a cyst on my ovary, that does not mean anything. What is important is the size of the cyst and the symptoms of the cyst and how the cyst looks on an ultrasound. So if a woman has a cyst and it's about 3 centimeters in diameter, and it looks just like a round, regular looking ball with just clear fluid in it, that's not a problem. If a woman has a cyst that is the size of an orange and it causes pain, and when you do the ultrasound, it has a lot of different compartments in it, then that may be a problem. When cysts reach a certain size, they can twist. And when they twist, that can become an emergency with severe pain, and a woman can lose her ovary like that. When a cyst gets big enough, it can rupture, and again, that can become an emergency. Or sometimes some cysts may be cancerous, depending on how they look. So when you talk about having a cyst in the ovary, the management depends on many different factors. There's a condition, I see somebody asking a question about polycystic ovaries, and that's a totally different thing. A polycystic ovary is an ovary that has a certain type of appearance. Most ovaries, if you look at them and you cut them, you'll see the areas where the eggs develop, and they'll be scattered randomly, like, you know what a chocolate chip cookie looks like, right? With polycystic ovaries, those areas, rather than being random, they are distributed like, you know what a pearl necklace looks like? They look like pearls. They look like a necklace or a bracelet. And when women have ovaries with that kind of appearance, we call the ovaries polycystic ovaries. Those cysts are not big enough to be cut out, but that kind of appearance can be associated with cycle problems. For example, irregular and heavy periods and fertility issues. So if you hear the word polycystic ovaries, it doesn't mean that the ovaries have to come out, but sometimes they can be associated with fertility issues, infertility, miscarriage, etc.
Thank you. What are some of the risks of getting pregnant having done a myomectomy and an ovarian cystomectomy?
Cystectomy.
Cystectomy. Thank you, Doc.
A myomectomy is the operation that is done to take fibroids out. And a cystectomy is something done to take a cyst out of an ovary. In medicine, when you hear ectomy, it means you take something out. So appendicectomy, you take out the appendix. So if you get pregnant after a myomectomy, one of the most important things is that you should be delivered by cesarean section. The greatest risk if you do become pregnant, the risk is going into labor, because when you have the uterus being cut to take fibroids out, the scars in the uterus can become compromised when the uterus stretches in pregnancy. Say if a woman has had a myomectomy, and myomectomies vary. Sometimes there's only one fibroid to take out. The most I've ever taken out of one woman at one time is 118. So you can have a whole heap of them. So if you have a lot of incisions, a lot of cuts in the uterus, and this woman now becomes pregnant, you really don't want that uterus to go into labor, because when the uterus goes into labor, there's a lot of pressure when it contracts, and those scars can rupture or dehisce. So it's important, if someone has had a myomectomy, it's very important to be followed up closely and to be delivered by cesarean section.
Thank you. Next question. Does hormone treatment causes weight gain? And can multivitamins be used instead of hormone replacement?
Some types of hormone replacement can cause weight gain, and again, it depends on the person, because some women are on hormone replacement and they gain no weight. Some will try one particular brand and have a lot of weight gain and have to come off. And multivitamins are definitely useful, but they will not get rid of the menopausal symptoms by themselves.
Is panic attack a part of menopause and feeling depressed at times?
Panic attack, I wouldn't say it's a part of menopause. I mean, but you can have mood changes. So there may be some depression for some women at the time of menopause, for sure.
Thank you. Are menopausal women more prone to heart attack due to low levels of estrogen?
That's another one of the things with menopause. You find that below the age of menopause, a woman's risk of heart attack is very low. But as the estrogen level drops and she enters menopause, then heart disease becomes a consideration, and she becomes at risk for that at that time. She's more at risk than prior to menopause.
Thank you. I had a hysterectomy due to endometriosis at age 40 and entered menopause prematurely. I am now 45 years old. How much longer will I continue to go through menopause?
And that is another good, I'm sorry that you're going through all of that stress. I'm sorry, whoever that is, man, but that is hard to predict because, for example, some women have no hot flashes and no menopausal symptoms. Some may have it for a few months, some may have it for over a year. So it's very difficult to forecast that. It's hard for me to tell that.
How soon after menopause should one start taking the hormones?
If, for example, it's surgical menopause, as soon as you can after surgery. In terms of hormone replacement, it depends on the severity of the symptoms, really. So if a woman is entering menopause and she realizes that, or has entered and realizes she's having hot flashes and the vaginal dryness, then at the time when she realizes she has the symptoms, that would be a good time to start.
Thank you. Can adenomyosis lead to menopause? Does menopause result in breast pains?
Good questions. Some women may have breast tenderness during the menopause, so that is true. Adenomyosis now is another condition. Yeah, see, I'm trying to avoid the big words, but I want to answer all the questions. So adenomyosis now is when a condition where the walls of the uterus are too thick. They become very, very thick. And this traumatizes and terrorizes a lot of women. It can cause heavy periods, painful periods, prolonged periods, and infertility. But it's not something that will make you go into early menopause. No.
Okay, thank you. Why does menopause cause an increase in cholesterol levels?
What happens is that with the hormone changes and the decreased estrogen, it affects the way your cholesterol is metabolized or dealt with, and that can cause the cholesterol level to elevate or to become higher. Human body is very complex. So when you have these hormonal changes, you have changes in the way, as I said, the cholesterol is metabolized, and that's why it happens.
Good night. Can PMS cause elevated blood pressure?
I haven't seen any studies that have correlated it with that, so I can't answer that question. In other words, not as far as I know or have seen. What can happen is that with PMS, it can be very stressful. So if you have if you have the emotional ability, you have the pain, for example, the pelvic pains or the breast tenderness, that stress alone can make your pressure be elevated a bit, but it's not known as a cause of hypertension or high blood pressure.
What are the health risks of endometriosis?
Endometriosis. So with endometriosis, as I said, you have some of the tissue like the lining of the womb on the outside of the womb where it's not supposed to be. And what can happen is that women can have severe pain. The pain can be severe during the period. Sometimes the pain is severe even after the period is over. Some women may have pain all the time. Some may have pain during intercourse. Another thing is that the endometriosis causes changes in the pelvis that can affect a woman's fertility significantly. It's one of the leading causes of infertility. And endometriosis in its most severe form can cause pain even in other parts of the body. For example, endometriosis has been found in the navel or the umbilicus. It's been found even in the lungs, even in the brain. I had a patient who had it so severe, she had lung problems, including collapse of her lungs. It can affect the bowel, so it can affect different organ systems when it is very severe.
Thank you.
But most of the time it's confined to the pelvis. For most people, it's confined to the pelvis.
Thank you, Doc. Caller wants to know, can you elaborate some more on the mental health issues related to menopause? And also wants to know if menopause can actually cause blindness.
I have not seen any research linking it to blindness, but there is evidence that some women do get depressed, as I said, at that time for different reasons. I mean, the hormonal change is one, but especially women who had fertility issues or wanted to have children and they realize that that phase of their life is over, it can actually precipitate depression.
Thank you.
I did a thyroid test and my T4 is 9.22. How can this be fixed?
What can it be? Fixed? She'd have to the best thing is to see a physician and start that out and be on the appropriate medication for that. That's usually not hard to deal with, to be honest with you. Whether someone has hypo or hyperthyroidism, whether it's overactive or underactive, they're not usually that hard to manage.
Okay, thank you. What if you experience severe pain on the first day of the period only? Is that reason for checking if you have fibroids or endometriosis, or is that normal?
That's another good question. Many women have pain on the first day. What I would tell the person is it depends on the severity of the pain. If the person notices pain but are able to go to work or go to school and engage in regular activities, that's not a problem. But if the pain consistently causes them to stay home from work or school, stay in bed, end up lying down on the ground, interfere with their normal activities, then it should be checked out, because no woman should ever have pain that interrupts her daily activities. And that's important. I'm glad I brought that up, because that is something I feel strongly about. There are many people who think that every woman, has periods and will have some pain, just deal with it. But all periods are not created equal or the same. It's very important to understand that. And some women have much more pain than others. And I find that sometimes, unfortunately, there's a lack of empathy for women going through period problems. So for example, you have some men who don't really understand anything, choice a period thing, whatever. And you even have some women who, because their periods are manageable, they assume everybody is experiencing what they experience. But some women have really, really, really awful, horrible periods. So it's important for everybody listening here that if a woman has a period that keeps her at home, prevents her from going to work, going to school, impairs her daily functioning, it needs to be sorted out. Women are not supposed to suffer like that. It's not normal.
Thank you, Doc. This is a young female. How does a young female know they have fibroids and what are the symptoms?
Most women who have fibroids probably have no symptoms. But if you have fibroids and you have symptoms, the commonest ones are prolonged periods or heavy periods or periods that are more painful. In other cases, when the fibroids get really big, you may notice some swelling or a mass in your belly or your belly getting bigger, because some of them can get really, really huge. Some can get so big that they go above where the belly button or the navel is. I've seen some about the size of 6 or 7 month pregnancies, so they can get very big. So if you notice any of those symptoms, you really need to be checked out.
Thank you.
What medication can be used to decrease blood flow and clots due to fibroids?
To decrease?
To decrease the blood flow and clots due to fibroids.
All right, to decrease the blood flow. Oh, okay, I see what you mean. They have certain medications that can be used. Some are hormonal. The hormonal medications can be given in the form of tablets or injections. And there are other drugs, for example, a drug called dicinone that we give, and that can be given in an injectable form, as well as orally. So there are different options. There are hormonal and non-hormonal options to decrease blood flow for women who have periods. And again, that is something best discussed with the physician.
Okay, thank you.
There are some situations, for example, where I mentioned before, the worst fibroids are the ones that bulge on the inside where you bleed from. There are some situations where if you have fibroids bulging into that area and they are big enough, so sometimes drugs won't help and you just have to have them surgically removed, because the drugs alone may not work. But for most women, drugs will be of some value.
Okay, thanks. The next question. Is hormone replacement recommended for someone who had breast cancer and now going through menopause?
That's a good question. And to be honest, when women have had breast cancer, it's best to avoid hormone replacement, because sometimes it may reactivate it. So it's really best to avoid it.
All right. Can a person experience dizziness or lightheadedness when approaching menopause?
Yes, they can. It is possible. With the hormonal fluctuations, it is possible for that to happen. But again, there are many different causes for dizziness and lightheadedness. So if a woman, for example, is in her early 50s and she's experiencing that, it's best not to assume it's because of the menopause. It could be due to, for example, anemia, like a low blood count. It could be due to a low blood pressure or elevated blood pressure. It could be due to even something like an ear infection. Ear infections can make you dizzy. So again, it's important not to just assume that it's because of the menopause.
I thought I was in menopause after not having my period for a year and 6 months, but then it returned and I continue seeing it every other month.
That can happen as well. Every now and then some women can enter what they think is menopause or menopause. The hormone levels correlate with it, and we say, okay, you're going into menopause. And then after a long time, the levels change and go back. I have a patient like that right now. It's uncommon, but it can happen. But any kind of strange bleeding like that should be evaluated. And I'll tell you why, because as women get older, the risk of cancer of the uterus increases. So a woman in her 20s is unlikely to have cancer of the uterus. When a woman reaches her late 40s or 50s, the risk increases. So any kind of abnormal bleeding in a woman in that age group really should be evaluated, because sometimes what can happen is that the bleeding that returns may not really be a true period, but it could be something else going on in the uterus. So it really should be evaluated.
Thank you. Caller says, I'm currently 16 weeks pregnant and I have been having constant headaches. What is the possible cause of this and what are your recommendations?
Again, there are many different causes for headache, ranging from migraine to high blood, to very, very high blood pressure, to stress. So again, that's something her physician would have to help her with.
Okay. Does doing a hysterectomy lowers estrogen levels and it ages you?
A hysterectomy doesn't necessarily lower hormone levels unless you take out the ovaries, and it doesn't age you either. If you're not going to take the ovaries out, then it shouldn't cause that, no.
Thank you. Can a woman just walk in an office, a doctor's office, and ask to be checked for fibroids? This person needs to know if hers has shrunk.
That shouldn't be a problem. I mean, most general practitioners, you can just walk in, and a lot of gynecologists, you can walk in as well. It shouldn't be a problem.
All right, thank you.
Can ovarian cyst and endometriosis or fibroids hinder or cause infertility?
Definitely. Endometriosis is a common cause of infertility. And fibroids, as I've mentioned before, depending on the size and the location, can definitely hinder a woman's fertility. On the other hand, many women have fibroids and have children. So having fibroids does not mean that you can't get pregnant. It's important to understand that as well.
Doc, person says a friend once said that her husband told her to control herself whenever she got a bit irritable during menopausal symptoms. What would you say to such a person?
That could be a complex issue because it's hard to really, when you say control it, I'm not sure what that means. But that is something best dealt with a counselor or a physician, because there are many reasons why he could be saying that. There are many reasons why her behavior may be like that, but it sounds, if it's because of her menopausal symptoms, I would tell her, I'd said, please don't tell her that, because women can't control the symptoms that they're going through at that time. It sounds a bit lacking in empathy to me. But again, that could be a deeper issue.
All right, Doc. So as we are winding down, tell us men, talk to me and the other men who have decided to come on the program with their wives tonight to hear and learn how we can really become more understanding, more accommodative to the women when they are going through the menopausal periods, when they are experiencing hormone changes. I realize that we have lots of questions here. Some we will have to take this up on another program.
Yeah.
But we really want to know as men, how do we deal with this so that we can have better loving relationships going forward?
I think one of the most important things that a man can do is to listen. One of the commonest complaints I get from women is that a lot of men don't listen. Sometimes you just need to keep quiet and listen to what they have to say. Not just listen to what they have to say, but to observe as well. Try to educate ourselves about these things, because nowadays with the internet, there's so much information online. It's important to understand, the cyclical changes women go through physically and emotionally. But as I said, one of the most important things a man can do is to listen and to communicate. Those are two of the most important things.
Thank you, Doc. So, gentlemen, we need to listen and we need to communicate so we can have a better understanding of what our females are going through. Caller wants to know, she's a young person, of course. She wants to know, is virginity bad for period cycle? And is the cycle more painful in single virgin women? And what are the cycles for depressing?
Virginity has nothing to do with it. Some women, however, will tell you that after they've had a child, they may have less period pain. But when it comes to virginity itself, like not having sex, that really makes no difference. Because there are many women who have not had sex and have no period issues, and there are many who are active who have period issues. So that doesn't have anything to do with it. There's no correlation, rather.
Thank you, Doc. Caller wants to know if you are at risk of breast cancer due to family history. Is it okay for that person to have a hormone replacement?
It is something best discussed with our doctor as well, because it depends on the degree of risk. It's really hard to tell. When you say family history, that varies so much, and there are different types of breast cancer. So that's something that would have to be discussed with a physician, and then a decision made. Are the benefits going to outweigh the potential risks? That's what it comes down to. So that's an individual decision.
Thank you, Doc. I know it's getting late. Tell me, what time is your cutoff time, Doc?
Well, I have to kind of help my son with something for school tomorrow, so.
Right, so we do take the last two questions. Let me see if I can put, there are so many questions out here.
I'm willing to come back in. I'm good with this. I mean,
Yes,
I'm glad that I'm engaging people and they're asking questions, because sometimes people don't have an opportunity to ask physicians questions like this. So I mean, I'm grateful. I'm very grateful.
Okay, I really appreciate that. We really appreciate you coming. Let me just ask these two questions here. Instead of a surgery, what can you do to shrink fibroids or a simple cyst? What can be done to prevent the regrowth of the cyst or the fibroid?
Let me tell you, that's a hard thing to answer, because every woman is different, and there hasn't been anything consistently proven long term. For example, there are these injections women can get that cut the estrogen level and make fibroids shrink. But because it cuts a woman's estrogen level, it puts them into what we call a pseudomenopause or a false menopause. So they will not only will they have hot flashes, but if you put them on it too long, you see this thing you were talking about earlier with losing bone, that can happen. So that kind of therapy is only good for like about 6 months. You don't give people longer than that. Then there was that drug that was manufactured for women with fibroids called Esmia, and that was like a godsend, because that drug, you put women on it and it would shrink their fibroids. They wouldn't disappear, but it would kind of shrink them. And recently the company recalled it because women were having like liver problems with it. So there's nothing consistently that I can tell you to do. Some women, when they alter their diet, for example, they become vegan or vegetarian, and they cut out like sugar and dairy and red meat and stuff like that, some women will get a favorable response. But that does not work for everybody. It's not consistent. With respect to the cyst, there's nothing really to do to really shrink them, to be honest with you. Some women who have endometriosis can get certain cysts that are associated with it. And again, some injections can shrink them and make them smaller, but they won't make them disappear.
Okay,
so we still have a lot of research to do.
Okay, Doc. Can blocked tubes be corrected by surgery only? And if yes, what is a possibility of pregnancy occurring after the surgery?
Not a good question again. When tubes are blocked, the success of the surgery depends on where the blockage is. So the uterus is like this and the tubes come out like this on either side, like this. If the blockage is at the end of the tube, those are the easiest ones to correct. If the blockage is somewhere like near to where the tube is, like here, sorry, this is the uterus and these are the tubes, right? If the blockage is where the uterus is, where the tube meets the uterus, those are very difficult to unblock, depending on the cause of the blockage. So there are some procedures that can be done to clear it, but it depends on where the blockage is. If it is that the blockage is, for example, towards the end of it, you can get pregnant, but it depends again on how well the tubes function. It's not enough to have a tube that is open. The tube has to work properly as well. because the tube is not rigid, it's very soft. So for example, you've had an infection and the tubes are blocked and also very badly scarred and damaged. Even if the tube is open, it may not work that well. So you find most cases where tubes are blocked, trying to unblock them is unsuccessful. Not all cases, but the majority. But when they are unblocked, the success rate again depends on where the blockage is and what causes it. So I really have a ballpark figure to tell you now, but most blocked tubes, most of the times you unblock them, they usually don't work that well. You may have to resort to other methods, for example, in vitro fertilization, where you fertilize the egg outside the body, and when it's fertilized, you put it in the uterus.
Thank you. Our final question. How does miscarriage or abortion impacts menopause?
Impact what?
Menopause. How does miscarriage or abortion impacts menopause?
Oh, and it doesn't have any impact on that, no. There's no correlation between having had miscarriages or having abortions and menopause. There's no correlation.
Okay, thank you.
There are so many questions, but we are out of time, listeners, viewers. It has indeed been a very wonderful night speaking with Dr. Michael Abrahams. We will have to take him back here and Straight Talk in the very, very near future.
Philip, it's my pleasure. I really, as I said, I'm grateful to be able to interact with my Jamaican people. It's a pleasure and an honor for me. Thank you very much.
You are most welcome, Doc. We are very
and thanks to everybody watching. Thanks to everybody watching. Thanks to everybody watching. Yes, pick up on yourself and keep safe. And I'm glad that I see men. I see a gentleman there. I love that. Fitzroy, is you that?
Actually,
yeah, big up yourself. No, I love that. No, I love that because you see, too many men are detached from women's issues, and it's good when men try to understand women. Too many women say women try to understand, but if you really sit down and talk to your partner a lot, you really can understand your partner. If you're willing to listen, just listen. Too many of us don't listen, but that's for another, and then bad things happen, but that's for another story.
All right. And definitely we will tell them about that in the near future. Viewers, you have been listening to Straight Talk.
Hi, Sharon.
Remember that on Straight Talk, we facilitate conversation about relevant topical issues to include marriage and the family, health, and finances. We do hope that you enjoyed the evening. I do hope that you learned a lot from the evening, that your questions were answered. And stay tuned for the next program. We will send out the notification in short order. Thank you for joining us. And on behalf of my wife and I, Avani, we say thank you and good night.
Night. Thanks again.
Usher you out with some music like how I ushered you in. Have a wonderful night to all our listeners. We thank you for having joined us tonight, and we hope you will continue to support Straight Talk. We will keep you informed.